Until now, I've had more or less a full head of hair. There's just the crown on the top there, which I can't see, which is gone. That went some time ago, but the rest has been holding out quite well. Now, in the last few weeks, horror of horrors, I've started to thin. I have a receding hairline now, and it's going really thin on top. I'm really worried about this. I am really worried about it, and I don't know whether I'll get to the stage where I'll start using, volumizing shampoo, anything to make it look thicker. But I'm really concerned. Now, what every bloke listening to this show wants to know now this morning is whether women like or prefer men with hair. So if I were to go bald, how would you feel about that? 01642 225511. Every man listening to the show is wanting some reassurance that everything will be all right if they go bald. Listening into this, one of the UK's leading hair transplant surgeons, Dr Asim Shahmalak from Manchester Crown Clinic. Doctor, good morning to you.
Good morning, Mike. Thanks for having me.
I am 52 and now I'm starting to thin. Is that fairly typical?
Well, hair loss can start, as your other presenter, other chap was saying, that it can start even in the teenagers. It can start as early as 18 or 19, and it can continue till late 40s and early 50s. However, hair loss does slow down after the age of 50, 55. And you were mentioning about yourself, that what can you do to prevent or to slow your hair loss down? Well, yes. There is only one medication in the wide world which is licensed for hair loss, and it's known as Finasteride. It's a 1 milligram tablet. You take the tablet a day. It slows the process or halts the process of hair loss down. It doesn't grow any new hair from somewhere, but it just halts it down.
And how much is that then? Because presumably that's not available on the NHS.
Well, that's true though, because these days the NHS are cost-cutting effects from left, right, and centre. So it's about depend on where you're getting it from. Sometimes people buy from the internet. You can get about £30 per month. And even Boots have their own supply. And
it's guaranteed to halt hair loss.
Well, there is no guarantee in life, is there? So it's a very, very highly recommended, and the research studies have showed that those people who take Finasteride along with the lotion, which is known as minoxidil, which also comes in a foam form known as Regain, if you take in the combination of minoxidil and Finasteride, the research studies have shown 91% of men who've been taking the combination therapy will keep whatever they have got.
Okay. And if I decide to have a hair transplant, then, I mean, that is quite a big undertaking, isn't it?
Well, these days, to be honest, as Brian was saying as well, that if you research decently well, and these days the technology has improved so drastically over the last 15 years, then that even those who are completely bald, unfortunately, they can have even decent amount of hair. It is a big undertaking in a sense, yes, but it is a minor surgical outpatient procedure.
And how? So I would go back once a week, would I, to gradually have it redone? Is that the way it works?
No, it doesn't once a week. Somebody comes in, and if they have got a small area in the front, they can have some until unless somebody comes in through the front door. Of course, you can't assess them. The individual assessment is entirely dependent. And also, if somebody wants to have the front area done, they can have it in one day. It's hardly 6 to 8 hours procedure. But depending if they want the large amount of done, then there's a technique called follicular unit extraction, which Wayne Rooney had. And if you cannot do whole head in one sitting, it may require more than one sitting.
But you can have it, an area done in just one session.
That's true.
And suddenly you have hair.
Not suddenly, of course. Yeah, they initially fall out. And the root remains deeply seated into the skin, and then they start growing out from 3 months on. But for the full result, we tend to wait for about a year, really, because hair have 3 different cycles. They grow in 3 different stages, and hence then they come out after 3 months onwards and continue to grow up for a lifetime.
Okay, Dr Asim Shahmalak, thank you very much indeed. We're talking about baldness. This is something that men really worry about. If you want to join in, love to get your take. Maybe you are bald. Should men just embrace their baldness? 01642 225511. Particularly want to hear from women as well about how they feel about men who are bald. Doing this on Facebook as well, if you want to put your comments on there.
Across Teesside, County Durham and North Yorkshire.
Proud of where we live. BBC Tees.
On 95 FM, on digital radio and online. This is BBC Tees. It's 10 o'clock and here's Hannah McMahon.
More than 400 North East jobs are set to go at energy firm npower as it announces it's shifting some jobs to India. The plans have been announced in the last hour, but Duncan Rothwell from the northern branch of Unison says the move can't be justified.
They've increased their prices by 10%, and last year they posted a profit of £390 million. Obviously that isn't enough for them. And chief executive earning £600,000 while making hundreds of people redundant.
Under the plans, npower will close its call centre in Thornaby in June next year, but all jobs would be transferred to Rainton near Sunderland. And more than 500 people who are currently working in Peterlee will also be moved to Rainton under the restructuring process. But James Ramsbotham from the North East Chamber of Commerce thinks it's a big ask for workers.
If you're on the sort of wages that a lot of these people will be on in Thornaby, and expecting them to manage the journey up to Rainton, which is quite a long way up the A19 and then onto the A690.